One of the most common questions that I get about language therapy is how do you pick words to target for therapy? One framework that is really helpful is the tiers of vocabulary, where we separate words into tier one, tier two, tier three. So, obviously, tier one would be conversational words that tend to be pretty easy for kids to learn implicitly. Tier two category words are words that tend to be difficult and occur across multiple subject areas and contexts. So, words like summarize, comprehend, things that come up on a lot of tests across different subject areas in school, and that might be a little bit more advanced and that we would see in texts that kids need to understand to be able to comprehend more difficult concepts, but they don't necessarily learn implicitly if they tend to struggle with language. And then we've got tier three words, which are specific to content areas. So things that might be considered science or social studies vocabulary, for example. And yes, there's some fluidity with these categories, but as a general rule of thumb, that's a way that you can problem solve in order to figure out where do I start when selecting target vocabulary for kids. And this is most appropriate for those kids who are in language therapy and are struggling with things like comprehension, can have a conversation with you, but when the language gets more complex, especially on those more difficult comprehension activities in academic subjects and things like that, if they're struggling to comprehend texts, if they have issues with executive functioning, those tier two vocabulary are a good place to start if you want to pick target vocabulary. And then the other question becomes, where do we actually go to get tier two vocabulary? So there are some tier two lists online. I actually have some available, but I recommend that you don't get too rigid with your understanding of how we pick vocabulary, because a lot of times people ask me what's age appropriate for a third grader, for example. Well, it's very difficult to answer that question because language development is so variable in the school age years because it's highly dependent on exposure. So a better question to be asking, rather than saying what vocabulary is age appropriate for fourth grade, for example, what we really want to be asking is what are kids being exposed to? And so that can be really difficult to pinpoint. Now, the reason that I offer Wordless is because that is something that gives you a starting point. They can help you to understand what a tier two word would look like so that you can recognize them when they come up. So think of it like a list of examples when you're looking through those word lists rather than a list of words that you have to get through. So a couple other things that you want to think about when selecting vocabulary. So, what if you don't have access to a word list? Well, you don't necessarily need one. Some people like to have them, so they have a bunch of words on hand, and that's always great to have something that's a go-to. But you can actually just go to your, collaborate with some of the teachers, and go around, ask the English and language arts teachers to look at some of their curricular materials, because a lot of the ELA curriculums have tier two vocabulary pulled out. Another place that you can look is that if you look in the content areas, ask the teachers for some of their tests or some of their materials. And yes, you want to look at the vocabulary, but you also want to look at the tests and the assignments and look at some of the words that come up over and over again. I had a situation where I was collaborating with a special ed teacher, and there was this whole group of kids that we both saw, and they were having a really difficult time on some of the math assessments. And the special ed teacher realized that it was because some of the vocabulary that was coming up over and over again that had to do with quantity was really tripping them up. So she actually worked with them on some of those words, and it transferred over to a lot of different other math assignments. So those are some places you can go to look. And yes, it's nice to have word lists, but really what you want to have instead is a protocol for picking the right words. Now, as a general rule of thumb, a good place to start is that you want to have maybe 1 to 3 target words that you have on hand that you can use in your language therapy with kids, but you want to be clear on what the goal is. Yes, it is beneficial to directly teach specific words. Yes, if we focus on tier 2 vocabulary, we can increase our students' ability to learn more difficult words. But it's not possible for us to get through all of the words that your students need to learn. And it's also very difficult for you to be able to keep up with all of the units that are happening. So that's not really the goal. The goal is that you want to pick words that you know are going to be beneficial across the entire year, across multiple contexts, and use those as probes and words to play around with as you are teaching strategies. So yes, you are teaching specific words in your sessions, but the sessions are really about using those words to develop a better understanding, increase metalinguistic knowledge, and increase awareness of word learning strategies. So it's really strategy based, and if you're doing that effectively, you are improving your students' problem solving skills, improving students' metalinguistic awareness, and their strategies that they can use to learn words in the future. And ideally what you want to do is improve your students' vocabulary skills, but also give them the skills that they need in order for them to start learning words when they leave your therapy session. So that's how we want to think about word selection. Again, Tier 2 word lists are great if you have them. Use those curricular materials and those Tier 2 word lists to be able to pull Tier 2 vocabulary from curricular materials. And yes, take opportunities to directly teach words, but really it's about what you do with those words and how you teach students strategies. So that's how we want to think about word selection, and that's how we can make our vocabulary useful and functional and actually support our students' problem-solving skills so that we get good generalization. So to learn more about my process for language therapy, check out my program, Language Therapy Advanced Foundations. You can actually get all the details of what is included in this program if you go to drkarenspeech.com/language therapy. And if you want to get the overview of what is included in the program and some of the strategies and the frameworks that I teach in order to build vocabulary skills in a way that supports metacognition, you might also enjoy my free online training for SLPs, where I go through my 5-component language therapy system. So to check out that training is free, and I do give you the opportunity to join Language Therapy Advanced Foundations at the end. But to check out that training, just go to drkarenspeech.com/language. So the free training and the overview is drkarenspeech.com/language, and the full program is drkarenspeech.com/language therapy. So I hope you found this helpful, and let me know if you have any other questions.